Opioid tolerance, dependence, and addiction are all manifestations of brain and central nervous system changes resulting from chronic opioid use. In this video, I'll let you know how opioids affect brain processes to produce tolerance, dependence, and withdrawal, so you can educate your patients better around these topics and support them in moving towards opioid reduction. Hey friends, welcome back to the channel. If you're new here, my name is Mahin and I'm an advanced practice physiotherapist specialising in pain management based in the UK. Although I can prescribe medication, most of my role as a prescriber is to help people reduce off high levels of medications that aren't helping their pain but producing various side effects. Today I'll let you know what happens to the brain with long-term opioid use. So let's get into it. Brain neurobiological causes resulting from the chronic use of opioids such as morphine, heroin, oxycodone, or other morphine-derived drugs are underlying causes of opioid dependence and addiction. It's important to know the difference between dependence and addiction. So dependence is the need to keep taking a drug to avoid withdrawal symptoms, whereas addiction is intense drug craving and compulsive use. So two very different things. The brain changes that produce dependence appear to resolve after detoxification, after a few days or weeks of stopping the opioid use. The abnormalities that produce addiction, however, are more wide-ranging, complex, and long-lasting. This may involve an interaction of environmental effects such as stress, the social context that the opioid is taken in, and also any psychological conditioning. There may even be a genetic predisposition in the form of brain pathways that may be there even before the opioid has ever started to be taken. And it's such abnormalities like this that can produce cravings that lead to relapses months or even years down the line after someone has stopped becoming opioid dependent. However, in this video, I'll be focusing specifically on changes that happen during opioid tolerance, dependence, and withdrawal specifically. There are many factors, both individual and environmental, that may influence whether someone will take opioids long enough to become dependent or addicted. This may include a lack of a stable, supportive environment, increased stress, reduced social connection, or other socioeconomical challenges. For people who do continue with an ongoing use, the opioid's ability to produce pleasure is a critical reason for this. When opioids travel to the brain, the chemicals attach to mu-opioid receptors in the brain. This triggers the same mesolimbic or midbrain reward system that rewards people with feelings of pleasure when they engage in activities that promote basic life functions such as eating and sex. This system generates signals in a part of the brain called the ventral tegmental area, or VTA, that results in the release of the chemical dopamine in another part of the brain, the nucleus accumbens. This release of dopamine into the nucleus accumbens causes the feeling of pleasure. Other areas of the brain creates a memory for the environment or the situation where these good feelings were felt. These memories often lead to the drug craving by that person. Now, when opioids are present, their suppressive impact is offset by heightened activity when they re-encounter that environment or those people again in the future. Usually, feedback from the prefrontal cortex to the VTA helps us overcome drives to obtain pleasure through actions that may be unsafe or unwise. But this feedback appears to be compromised in individuals who become addicted to drugs. This mesolimbic reward system is also one of the greatest factors leading to opioid dependence and addiction. Therefore, understanding how withdrawal is related to the changes that are happening within the brain can be really helpful in helping somebody address or treat these withdrawal symptoms and reduce their opioids gradually over time. Repeated exposure to escalating doses of opioids basically means that the brain is functioning well when those drugs are present and abnormally when those drugs are not present. Two clinically important results of this alteration are opioid tolerance, which is the need for higher doses of the same medication to have the same result, and opioid dependence, which is the susceptibility to withdrawal symptoms. It's really important to note that withdrawal symptoms only occur in those people who have developed opioid tolerance. And opioid tolerance occurs because the brain cells that have opioid receptors on them gradually become less responsive to the opioid stimulation. Therefore, more opioid is needed to stimulate the VTA brain cells of the mesolimbic reward system to release the same amount of dopamine in the nucleus accumbens and produce the same amount of pleasure and pain relief to that provided at previous lower doses. Opioid dependence and withdrawal stem from changes in another brain system which is situated at the base of the brain called the locus coeruleus, or LC for short. Neurons in the LC produce noradrenaline and distribute it to other parts of the brain where it stimulates wakefulness, breathing, blood pressure, and general alertness, among other functions. When opioid molecules link to mu receptors on the brain cells in the LC, they suppress the neuron's release of noradrenaline, resulting in drowsiness, slowed respiration, and low blood pressure, all of which are common side effects of opioid use. However, with the repeated exposure to opioids, the LC neurons adjust by increasing their activity levels. This means that usual levels of noradrenaline are released and the patient feels more or less normal. However, when opioids are not present to suppress the LC brain cells' enhanced activity, the neurons release excessive amounts of noradrenaline, triggering the shakes, anxiety, muscle cramps and diarrhea, all of which are common withdrawal effects. But the good news is, if no further opioids are taken, then the LC neurons will revert back to their usual level of activities over a period of time. Given the complex biological, psychological, and social aspects of opioid dependence talked about in this video, it's really important that patients receive the correct psychosocial support whilst they're coming off high levels of opioids to prevent them going on higher doses in the future. I'm always very grateful to have access to psychological support for my patients to help them while they are reducing off the high levels of opioids under my supervision, because this makes that journey just a lot more manageable. It's a tough journey anyway with opioid reduction, but this is definitely helpful for that. For you clinicians watching this, an awareness of the neurobiological basis of opioid dependence and sharing this information with your patients in an easy to understand way can provide insight into your patients' behaviours and clarify the rationale for treatment methods and goals. For those of you watching this video who are taking opioids and would like to consider a reduction, please speak to your GP, physician or pain specialist about this. It's really important that you get support and guidance on how to do this. Opioids must not be stopped straight away, so it's really important that you seek the appropriate guidance from these professionals to help you gradually reduce off this medication with support. For more information on why opioids don't work in the long term for chronic pain so that you can explain this to your patients better, check out this next video here. Thanks for watching, take care, and I'll see you next week.